Good morning, good afternoon, good evening. I'm Trevor Hassell, President of the Healthy Caribbean Coalition. And it is my pleasure to welcome you on behalf of the directors and members to the HCC's first virtual regional conference on NCD prevention and control. Today's conference is headlined Transformative New NCD Agenda, and will, among others, focus on a transformative approaches aimed at a more effective Caribbean response to NCDs. The specific issue which we will be discussing during the conference is the acceleration of food policies to tackle NCDs. This is a very topical issue, made more so by the COVID-19 pandemic, which has highlighted the unsustainability of our food systems and food insecurity. We in the HCC are especially happy to recognize the significant numbers of supporters, stakeholders, and members that have come together to share experiences. And so once again, a great big welcome to all. And I look forward to an exciting day of discussions. And so with those a few words of welcome, I now invite Maisha Hutton, Executive Director of the Healthy Caribbean Coalition, to give her welcoming remarks and provide an outline of the meeting. Maisha.
Thank you, Sir Trevor. Good morning, good afternoon, good evening. The team is so excited to see so many of you from across the Caribbean participating today and beyond as well. Welcome and thank you for joining us. Each year, the HCC hosts a regional multi-stakeholder meeting, an opportunity for Caribbean civil society to come together with partners from the public sector and the private sector to share experiences and solutions for NCD prevention and control. This year, we're meeting virtually. So although we can't greet one another with our customary Caribbean warmth, we have tried to recreate our meeting in a virtual world, complete with avatars, with virtual spaces like our exhibit hall, our lobby and lounge, where you can learn, meet, network, and chat. So please explore this space. We are here today to talk about our food. 60% of disability-adjusted life years lost in the region are due to unhealthy diets. Yes, 60%. We all know the rest of the data, the burden of NCDs, and the absurdly high and growing rates of obesity among adults and children. Unhealthy diets dominated by cheap, heavily marketed, ultra-processed foods are driving the obesity and NCD epidemics. We must transform the way we eat. Today, we will explore policies which will ultimately lead to greater availability, accessibility, and consumption of healthy, nutritious, real food. We will take you through 5 core sessions and 10 concurrent lunchtime sessions. We will look at the food system and key policies needed to improve the nutritional quality and sustainability of the regional food supply. We will discuss the evidence-based policy interventions needed to reshape our food environments and explore barriers to policy implementation, tackling complex issues such as conflict of interest and countering of industry interference in public health policy making. At lunch, we will have a buffet, a wide range of intimate conversations where you can interact with colleagues on a variety of topics, including climate change, human rights and the law, marketing to children, and the list goes on. After lunch, we will celebrate the power of people, of us, working together to drive meaningful, lasting change, much as we have done over the past few months for warning labels, a drumbeat like this region has never seen before. And then we will be reminded of why we do what we do, and we will hear the voices of those most affected, people living with NCDs, and young people who will bear the burden of our collective inability to act with urgency if we don't transform our ways now. Finally, chairs of our regional NCD commissions, champions and stewards of the NCD movement will reflect on the past years of COVID-19 and share perspectives on the future of the NCD response in the Caribbean. A future which we hope to be transformative, underpinned by the principles of human rights and equity, in which an emboldened and empowered Caribbean citizen demands better, and our political leaders deliver on commitments, now over 15 years old. We have wonderful speakers and panelists with us today. Some are part of our close-knit HCC family, and others are newcomers who we welcome warmly with open arms. We have a packed agenda, characteristically HCC. So once again, on behalf of our HCC team, our technical advisors, the board of directors, and our patron, thank you for joining us. Sir Trevor.
So thank you very much, Maisha. And so it is now my pleasure to invite representatives of two of the Healthy Caribbean's Coalition's major regional supporting and collaborating organizations to bring greetings. And in that regard, the first individual I'd like to introduce to bring greetings is Ms. Renata Clarke, FAO Subregional Coordinator for the Caribbean. Renata.
Thank you, Sir Trevor. Thank you, Maisha. It's really a pleasure to be here for this event, to speak about an update on the Food System Summit and FAO's related work. Our food system in the Caribbean has been dysfunctional for some time. There's a high degree of poverty and vulnerability among our small-scale farmers. Our productivity is low. We import most of what we eat, and we have growing problems of both undernutrition and obesity. Our environment is also being degraded. Some countries keep underlining that we do need to improve our food systems, but just a few tweaks might work. I've enjoyed hearing the word transform mentioned several times by both Sir Trevor and Maisha. FAO believes that in the Caribbean, we do need a much more transformative vision, and apparently so do you. The CARICOM Secretariat organized a regional dialogue on food systems. At the end of May, heads of state and ministers shared their thinking about food systems transformation. It was a powerful meeting. As His Excellency Sir Mohammed Irfan Ali, President of the Cooperative Republic of Guyana, stated at that dialogue, the region's food system transformation is at the core of our development aspirations. It will require greater attention to be paid to its food systems, especially in terms of ensuring food security, combating the threats posed by climate change, and being able to mobilize financing for climate resilient agriculture. This statement actually embodies the three main areas of focus during the dialogue. And those are policy orientation and actions needed to ensure food security and healthy diets. Secondly, the need to invest in building resilience to the impacts of climate change. And thirdly, strategies for funding and financing that will catalyze the needed transformation. The report of the regional dialogue will ensure that this strong Caribbean perspective resonates throughout the pre-summit, the pre-food system summit, which is being held in Rome at the end of July, and the global summit that is held in New York in September. It's not just about words, it's about garnering support for solutions that the Caribbean countries have carved out. FAO is working with the countries of the Caribbean to transform food systems and to enable sustainable and inclusive agriculture systems that play a leading role in the COVID recovery. Prime Minister Mia Mottley has frequently underlined the importance of the region's goal to reduce food imports by 25% by 2025. At the regional dialogue, she pointed to the need to be even more ambitious, and that as a region, we need to expedite the process of producing as much food as we can. FAO is supporting countries to review and revise agriculture and fisheries policies and strategies, to develop sound value chain development strategies that are market-driven and create more than decent jobs in agriculture and agribusiness for our youth, our women, and our men. We are supporting countries to leverage climate financing to enable them to meet their goals for climate change adaptation in agriculture, fisheries, and forestries. We are currently putting significant emphasis on the use of integrated data systems that enable early warning and anticipatory action that reduce loss to climate-related risks. Finally, we are supporting data and evidence-informed nutrition policies and programs. With the support of FAO and the University of the West Indies, St. Kitts and Nevis has completed an individual food consumption survey. We look forward to seeing St. Kitts and Nevis leading the way in the Caribbean in developing sound nutrition policies and targeted programs. We're also committed to school feeding programs that instill good eating habits, provide an important social safety net, and create markets for healthy local produce. The time is now to start putting things right. Thank you.
And so thanks very much, Dr. Clarke, for that very comprehensive and in many respects inspirational presentation. I now invite Mr. Dean Chambliss, PAHO Subregional Program Director, to bring greetings. Mr. Chambliss.
Thank you, Sir Trevor, and good morning to all on the call. It is my pleasure to bring greetings on behalf of PAHO to this exciting and motivating virtual regional conference, Our Food, Our Health, Our People, aimed at building regional momentum for the implementation of healthy food policies. I am pleased to join the Healthy Caribbean Coalition and many of our long-standing partners for what is an urgent conversation about NCDs, overweight, and obesity, grounded in the principles of human rights and equity. It is only through a health in all policies, whole of society, and whole of government approach that we will be able to make significant headway on these issues. PAHO is proud of its partnership and collaboration with the HCC through the years, recognizing the unique role that civil society has to play. As we know, NCDs remain the leading causes of mortality, diseases, and disability in the Caribbean, representing almost 8 out of every 10 deaths in the region. High blood pressure, high fasting blood sugar levels, and overweight and obesity are the main drivers of this burden, causing 47% of all deaths and the loss of 4.6 million years of healthy life in 2019 alone. And these are years of life that were lost not only because people died prematurely, but also because they lived without being able to complete routine activities, such as going to school, working, playing, and enjoying their lives to their full potential. In the Caribbean, high blood pressure, high fasting blood sugar levels, and overweight and obesity are closely linked to unhealthy diets and an excessive intake of sugars, total fats, saturated fats, trans fats, and sodium. In turn, the excessive intake of these critical nutrients of public health concern is largely driven by the widespread availability, affordability, and promotion of processed and ultra-processed food products with unhealthy profiles. The silent crisis of NCDs and unhealthy diets has far-reaching consequences for the human and socioeconomic development of our region. The Caribbean now has the highest rates of childhood overweight and obesity in the Americas, which not only undermines the physical, social, and psychological well-being of our children, but also represents a known risk factor for adult obesity and NCDs, causing premature deaths throughout the life course. Furthermore, persons living with NCDs face a greater risk of becoming severely ill or dying from COVID-19. It is estimated that at least 1/3 of the Caribbean population is at such higher risk, based on the presence of at least one underlying condition. In addition, the public health measures put in place to curb the spread of the virus, including lockdowns and school closures, the disruption of food chains, and the pandemic-related economic fallout, continue to have a negative impact on diet and physical activity. Addressing NCDs is clearly essential for equitable economic recovery and resilience in the wake of the COVID pandemic. Against this dire background, the purpose of today's conference is to focus on the solutions. The pandemic provides an opportunity for action and change, as HCC is called for through its transformative new NCD agenda. CARICOM heads of state and government have already prioritized the development of a regional agenda on food and nutrition security to tackle CARICOM's significant import bill, which has been noted as an opportunity to address NCDs. Another essential part of the solution is the use of laws and regulations to reduce the demand for and offer of processed and ultra-processed products that contain excessive amounts of sugar, fats, and sodium. Part of our discussion today will be focused on policy measures that we can take as part of a comprehensive strategy to create healthier food environments. There are also important opportunities to catalyze progress on this front. Just yesterday, the Caribbean Court of Justice Academy for Law, in collaboration with PAHO, launched the Caribbean Public Health Law Forum. This forum brings together CARICOM institutions, governments, civil society, and academia to facilitate communication, collaboration, and engagement between the health and legal affairs to address NCDs. Another crucial opportunity is the ongoing process led since 2018 by CrossQ, the CARICOM Regional Organization for Standards and Quality, to revise the current standard for prepackaged foods to incorporate front-of-package warning label specifications. This has been done through an extensive consultative process involving all relevant stakeholders. The resulting final draft CARICOM regional standard is based on the most rigorous scientific evidence, including octagonal warning labels to indicate if a product is high in sugars, total fats, saturated fats, trans fats, and/or sodium. It incorporates the PAHO nutrient profile model, PAHO NPM, which has established the thresholds that define when these critical nutrients of public health concern are in excess. There are hundreds of different front-of-package labeling systems applied to products worldwide with different purposes. However, there is now a large body of scientific evidence, free from conflict of interest, including a randomized controlled trial conducted in Jamaica, showing the octagonal front-of-package warning labels are the best performing system for the intended regulatory objective of allowing consumers to correctly, quickly, and easily identify products that contain excessive amounts of critical nutrients. Front-of-package warning labels are supported by strong regional mandates, including the Port of Spain Declaration, the communiques of the 37th and 39th Conference of Heads of State and Government, and CARFA's 6-point policy package to address overweight and obesity. Moreover, the UN Special Rapporteur on the Right to Health has recognized octagonal front-of-package warning labels as an effective tool to protect the right to health and to adequate food, noting that it balances the starting point for all consumers by providing quality and access to information relevant to health. Front-of-package warning labels can also serve as an enabler of other key policies, such as the restriction of marketing to children, taxation, or school-based interventions. We are therefore at a turning point in which real change is possible, and we must approach this opportunity with a sense of urgency. Without clear efforts to promote action on the prevention of unhealthy diets, the rise of NCDs will remain unstoppable. This will have irreparable consequences on health and development. Now more than ever, the health and well-being of our people, our children, needs to be prioritized. Thank you for your participation today, and I look forward to a rich and fruitful discussion.
And so thank you very much, Mr. Chambliss. And let me use this opportunity to recognize the significant technical role that PAHO has been playing in advancing food policies in response to the NCD epidemic. This is truly significant and important. At this point, it now gives me a significant pleasure to introduce our distinguished speaker in the opening session of our conference, and that is Dr. Carla Barnett, who is the CARICOM Secretary General Designate. Dr. Barnett, over to you.
Good morning, everyone. Thank you, Sir Trevor and Healthy Caribbean Coalition for inviting me to make a few opening remarks to you today in my capacity as CARICOM's Secretary General Designate. I'm really very pleased to be here. The explosion of non-communicable diseases in the region in the last few decades as our lifestyle evolved, the links across obesity, cancer, heart disease, diabetes, hypertension, cardiovascular disease, chronic respiratory diseases, and mental disorders. The negative impact of NCDs on the quality of life and productivity of our Caribbean people. All these are very important considerations from a public policy point of view. This discussion is not new to CARICOM. 20 years ago, the Conference of Heads of Government issued the Nassau Declaration on Health. The health of the region is the wealth of the region, which acknowledged the critical role of health in economic development and the threat of health problems impeding this development by devastating our human capital. At that time, HIV/AIDS was topical. Heads recognized the need for access to services for vulnerable groups, behavioral change in the youth, and the empowerment of women. They took account of the successes of our region in collaboration with the international community to successfully combat major public health problems, such as polio and measles and cholera. These diseases were defeated by vaccines and hygiene programs, facts that are very relevant in the present fight against COVID-19. This Nassau Declaration also recommitted to the work of the Caribbean Cooperation in Health and listed several strategic plans that should follow, including a regional strategic plan for the prevention and control of the chronic non-communicable diseases, which should have been completed in 2002. In retrospect, this really was a short time to complete this plan, but a lot of work was done. And in 2007, after a special summit on chronic non-communicable diseases, CARICOM heads, and I quote, impelled by a determination to reduce the suffering and burdens caused by NCDs on the citizens of our region, which is the worst one affected in the Americas, end of quote, issued the declaration of Port of Spain, uniting to stop the epidemic of chronic NCDs, which affirmed the need to prevent and control NCDs. CARICOM was the first region in the world to take NCDs so seriously as to have a summit of our heads of government meet to especially consider the impact and the implications for the future. 4 years later, heads of state and government at the first UN high-level meeting on the prevention and control of NCDs expressed grave concern about the vicious cycle where NCDs and their risk factors worsen poverty, while poverty contributes to rising rates of NCDs, posing a threat to public health and economic development. Health professionals able to convince CARICOM heads of the criticality of focusing on NCDs? The answer is quite simple. You are able to do this by demonstrating the huge current and future costs of NCDs. NCDs are leading cause of mortality and sickness in our society. By 2016, NCDs were responsible for 77% of all deaths in the Caribbean. Moreover, 38% of all NCD deaths occurred in persons under 70 years of age. And most shocking of all to me, people in the non-Latin, mostly English-speaking countries of the Caribbean had the highest probability in this whole hemisphere of dying prematurely, that is between the ages of 30 and 70. In addition to loss of life, there is loss in household income, decline in productivity, and reduced gross domestic product. There are studies that confirm these costs and studies that show how relatively small investments in prevention, interventions, and treatment would yield respectable returns on investment and growth in GDP. Having established this, however, we, governments, health professionals, international partners, producers, consumers, all of us together, have been spending a long time considering how to design and implement acceptable and effective solutions. Part of the difficulty is that many of the changes that are required are cultural or lifestyle changes. Eating more healthy food, returning to more healthy lifestyles, reducing alcohol and tobacco consumption. In a cultural reality where an indication of prosperity is the ability to purchase prepared food, it is not surprising that increased income has led to eating more restaurant food and imported processed food. The other side of that reality is that families in poverty cannot access low-cost, healthy, locally grown food. This situation was worsened as the loss of jobs in the COVID-induced economic downturn resulted in many more vulnerable people being unable to access healthy food, with all the negative implications for persons with NDCs. Cheap, healthy food is just not available. Cheap food is now imported from abroad in cans, boxes, bottles, and plastic bags. More than 60% of the food consumed in our region is imported. And these are, as others have said before me, these are largely processed and ultra-processed foods. When COVID disrupted supply chains globally, giving new meaning to food insecurity in countries that import most of their food, this gave impetus across our region to the importance of expanding domestic food production. At the level of CARICOM, long made public policy decisions about ramping up food production in the region are being revisited, and great urgency is being given to plans for agriculture sector development. Which brings us to the subject of your meeting today. Our food, our health, our people, accelerating healthy food policies to tackle NCDs. The timing is excellent. Your conversation about healthy food is taking place in a context in which the focus within CARICOM is already on increasing the production of farm fresh foods, which suggests a present strategic opportunity for alliances across the health and agricultural sectors. Healthy Caribbean Coalition can support this effort by advocating for increased consumption of fresh food because it is good for our health, it is good for food security, and it strengthens our economy. I want to close by thanking the Healthy Caribbean Coalition for the role that it plays in coordinating civil society organizations to advocate for policies and actions that promote good health of Caribbean people. Here in Belize, we are privileged to have Mrs. Laura Longford as a strong advocate for healthy living. I am sure she brings the same passion to her role on the board of the coalition. I also want to acknowledge the civil society organizations in the region, partner agencies and experts who contribute to the critical work of the Healthy Caribbean Coalition. I look forward to assuming the role of CARICOM Secretary General on August 15 and giving priority to broadening the range of community stakeholders, including civil society, that are kept abreast of CARICOM work, that contribute to discussions of critical community issues, and whose advice can help to improve the formulation of community policy. So don't be surprised that I do expect to receive recommendations of policy development and other suggestions arising out of this conference and after. The issues facing the region, from tackling NCDs to building resilience to climate change, strengthening food security, reducing poverty, all these issues need many hands on deck. So I wish you well for a productive meeting, and I look forward to receiving any recommendations that you may wish to give after your meeting. Thank you very much.
And thank you, Dr. Barnett. And let me say that we in the Healthy Caribbean Coalition look forward to a long and fruitful relationship with you as you take up your very important post as Secretary General of CARICOM. And so the scene has been set for what I know will be a very rich discussion going forward.